BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 8. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. An abnormality of hemoglobin synthesis causes. Option A. Hereditary spherocytosis. Option B. Sickle cell disease. Option C. G6PD deficiency. Option D. Beta thalassemia. The correct answer is option D. Beta thalassemia. Let's go through the options. Hereditary spherocytosis. Hereditary spherocytosis is a membrane defect, not a hemoglobin one. Sickle cell disease. Sickle cell is a structural hemoglobin variant, but the classic synthesis defect is thalassemia. G6PD deficiency. G6PD deficiency is an enzyme defect. And the correct answer is beta thalassemia. Correct. Beta thalassemia is a defect of globin chain, hemoglobin synthesis. So, the right answer is option D. Beta thalassemia. Question 2. Arthropathy with inflammatory bowel disease is more common in. Option A. Ulcerative colitis. Option B. Crohn's disease. Option C. Celiac disease. Option D. Diverticulitis. The correct answer is option B. Crohn's disease. Let's go through the options. Ulcerative colitis. Arthropathy occurs in UC but is more classic in Crohn. Celiac disease. Celiac disease is not the main IBD arthropathy link. Diverticulitis. Diverticulitis is not an inflammatory bowel disease. And the correct answer is Crohn's disease. Correct. Enteropathic arthropathy is more common with Crohn's disease. So, the right answer is option B. Crohn's disease. Question 3. Which of the following is not a live vaccine? Option A. Hepatitis B. Option B. BCG. Option C. Oral polio. Option D. Measles. The correct answer is option A. Hepatitis B. Let's go through the options. BCG. BCG is a live attenuated vaccine. Oral polio. Oral polio is live attenuated. Measles. Measles is a live attenuated vaccine. And the correct answer is hepatitis B. Correct. Hepatitis B vaccine is a recombinant, inactivated vaccine, not live. So, the right answer is option A. Hepatitis B. Question 4. Celiac disease is confirmed by. Option A. Small bowel biopsy. Option B. Stool culture. Option C. barium meal. Option D. colonoscopy. The correct answer is option A. Small bowel biopsy. Let's go through the options. Stool culture. Stool culture does not diagnose it. Barium meal. Barium meal is non-specific. Colonoscopy. Colonoscopy examines the large bowel, not the affected proximal small intestine. And the correct answer is small bowel biopsy. Correct. Celiac disease is confirmed by small bowel, duodenal, biopsy showing villus atrophy. So, the right answer is option A. Small bowel biopsy. Question 5. Ventricular septal defect carries a risk of. Option A. Pulmonary stenosis. Option B. Bacterial endocarditis. Option C. Aortic dissection. Option D. Cardiac tamponade. The correct answer is option B. Bacterial endocarditis. Let's go through the options. Pulmonary stenosis. Pulmonary stenosis is a separate lesion. Aortic dissection. Aortic dissection is unrelated. Cardiac tamponade. Cardiac tamponade is not the characteristic risk. And the correct answer is bacterial endocarditis. Correct, a VSD carries a risk of bacterial, infective, endocarditis. So, the right answer is option B. Bacterial endocarditis. Question 6. Cystic fibrosis is complicated by all of the following except Option A. Pancreatic insufficiency. Option B. Bronchiectasis. Option C. Proliferative glomerulonephritis. Option D. Meconium ileus. The correct answer is option C. Proliferative glomerulonephritis. Let's go through the options. Pancreatic insufficiency. Pancreatic insufficiency occurs in CF. Bronchiectasis. Bronchiectasis occurs in CF. Meconium ileus. Meconium ileus is a classic CF presentation. And the correct answer is proliferative glomerulonephritis. Correct, proliferative glomerulonephritis is not a feature of cystic fibrosis. So, the right answer is option C. Proliferative glomerulonephritis. Question 7. Anovulation may result from Option A. Hyperthyroidism. Option B. Hypothyroidism only. Option C. Hyperkalemia. Option D. Hypercalcemia. The correct answer is option A. Hyperthyroidism. Let's go through the options. Hypothyroidism only. Saying hypothyroidism only is too restrictive. Hyperkalemia. Hyperkalemia does not cause anovulation. Hypercalcemia. Hypercalcemia does not cause anovulation. And the correct answer is hyperthyroidism. Correct, hyperthyroidism and thyroid dysfunction can cause anovulation. So, the right answer is option A. Hyperthyroidism. Question 8. In anemia of pregnancy, which index characteristically changes? Option A. MCV is unchanged always. Option B. MCHC falls to 0. Option C. MCHC increases. Option D. RDW falls. The correct answer is option C. MCHC increases. Let's go through the options. MCV is unchanged always. Saying MCV is always unchanged is wrong, it varies with cause. MCHC falls to 0. MCHC does not fall to 0. RDW falls. RDW usually rises in deficiency, not falls. And the correct answer is MCHC increases. Correct, in the physiological dilution iron picture, the key answer here is a change in MCHC. Iron deficient pregnancy lowers MCHC, item wording debatable, flagged. So, the right answer is option C. MCHC increases. Question 9. Bacterial pharyngitis characteristically causes Option A. Thrombocytosis. Option B. Leukocytosis always. Option C. Eosinophilia. Option D. A fall in total leukocyte count. The correct answer is option D. A fall in total leukocyte count. Let's go through the options. Thrombocytosis. Thrombocytosis is not the hallmark of pharyngitis. Leukocytosis always overstates leukocytosis. Eosinophilia. Eosinophilia suggests allergy parasites, not bacterial pharyngitis. And the correct answer is a fall in total leukocyte count. Correct. Per key, some viral severe pharyngitis shows a low leukocyte count, not bacterial usually raises it. Flagged. So, the right answer is option D. A fall in total leukocyte count. Question 10. Malaria parasites are notable because they are: option A, gram-positive. Option B, extracellular only. Option C, not phagocytosed in the usual way. Option D, non-infective. The correct answer is option C, not phagocytosed in the usual way. Let's go through the options. Gram-positive. Malaria parasites are protozoa, not gram-positive bacteria. Extracellular only. They are intracellular in red cells, not extracellular only. Non-infective. They are highly infective. And the correct answer is not phagocytosed in the usual way. Correct. Intraerythrocytic parasites evade normal phagocytosis. So, the right answer is option C. Not phagocytosed in the usual way. Question 11. In sarcoidosis of childhood, which is not a feature? Option A, uveitis. Option B, generalized 3 Hz spike and wave on EEG. Option C, arthritis. Option D, skin rash. The correct answer is option B, generalized 3 Hz spike and wave on EEG. Let's go through the options. Uveitis. Uveitis is a feature of childhood sarcoidosis. Arthritis. Arthritis is a feature. Skin rash. A skin rash is a feature. And the correct answer is generalized 3 Hz spike and wave on EEG. Correct. A 3 Hz spike and wave EEG is absence epilepsy, not sarcoidosis, so it is the exception. So, the right answer is option B. Generalized 3 Hz spike and wave on EEG. Question 12. In diverticulitis, the inflammation involves: option A, submucosa only. Option B, mucosa only. Option C, serosa only. Option D, all layers of the colon. The correct answer is option D, all layers of the colon. Let's go through the options. Submucosa only. Submucosa alone understates diverticulitis. Mucosa only. Mucosa alone understates it. Serosa only. Serosa alone is incorrect. And the correct answer is all layers of the colon. Correct. Established diverticulitis involves the full thickness, transmural, of the colonic wall. So, the right answer is option D, all layers of the colon. Question 13. Colonic diverticula occur most commonly in the: option A, transverse colon. Option B, cecum. Option C, sigmoid colon. Option D, rectum. The correct answer is option C, sigmoid colon. Let's go through the options. Transverse colon. The transverse colon is a less common site. Cecum. The cecum is a less common site. Rectum. The rectum characteristically does not form diverticula. And the correct answer is sigmoid colon. Correct. Diverticula are commonest in the sigmoid colon. So, the right answer is option C. Sigmund colon. Question 14. Anemia is a recognized cause of which cardiac response? Option A. Heart block. Option B. Bradycardia. Option C. Tachycardia. Option D. Atrial fibrillation. The correct answer is option C. Tachycardia. Let's go through the options. Heart block. Anemia does not typically cause heart block. Bradycardia. Anemia causes tachycardia, not bradycardia. Atrial fibrillation. Atrial fibrillation is not the characteristic response. And the correct answer is tachycardia. Correct anemia causes a compensatory tachycardia, high output state. So, the right answer is option C. Tachycardia. Question 15. Aplastic anemia is primarily a disease of Option A. Children and younger adults. Option B. The elderly only. Option C. Neonates only. Option D. Pregnant women only. The correct answer is option A. Children and younger adults. Let's go through the options. The elderly only. It is not confined to the elderly. Neonates only. It is not confined to neonates. Pregnant women only. It is not confined to pregnancy. And the correct answer is children and younger adults. Correct. Aplastic anemia has a peak in children and young adults, though it occurs at any age. So, the right answer is option A. Children and younger adults. Question 16. Acute renal failure is best described as kidney failure developing over Option A. Several years. Option B. Several months. Option C. A few hours to a few days. Option D. Minutes. The correct answer is option C. A few hours to a few days. Let's go through the options. Several years. Years is chronic renal failure, not acute. Several months. Months is chronic, not acute. Minutes. Minutes is too brief a definition. And the correct answer is a few hours to a few days. Correct. Acute renal failure, AKI, develops over hours to a few days. So, the right answer is option C. A few hours to a few days. Question 17. Uremic encephalopathy is managed with Option A. Lactulose. Option B. Dialysis and fluid correction. Option C. Plasmapheresis. Option D. Steroids. The correct answer is option B. Dialysis and fluid correction. Let's go through the options. Lactulose. Lactulose treats hepatic, not uremic, encephalopathy. Plasmapheresis. Plasmapheresis is not the standard treatment. Steroids. Steroids are not the treatment. And the correct answer is dialysis and fluid correction. Correct. Uremic encephalopathy is corrected by dialysis and fluid electrolyte correction. So, the right answer is option B. Dialysis and fluid correction. Question 18. Hepatic encephalopathy is managed with Option A. Lactulose and antibiotics. Option B. Dialysis. Option C. Plasmapheresis. Option D. Diuretics. The correct answer is option A. Lactulose and antibiotics. Let's go through the options. Dialysis. Dialysis is for renal failure. Plasmapheresis. Plasmapheresis is not standard. Diuretics. Diuretics treat ascites, not the encephalopathy directly. And the correct answer is lactulose and antibiotics. Correct hepatic encephalopathy is managed with lactulose and antibiotics, e.g. rifaximin, to reduce ammonia. So, the right answer is option A. Lactulose and antibiotics. Question 19. Which cell type is chiefly infected in HIV? Option A. T4 helper lymphocytes. Option B. B lymphocytes. Option C. Neutrophils. Option D. Platelets. The correct answer is option A. T4 helper lymphocytes. Let's go through the options. B lymphocytes. B lymphocytes are not the primary target. Neutrophils. Neutrophils are not the primary target. Platelets. Platelets are not the primary target. And the correct answer is T4 helper lymphocytes. Correct. HIV chiefly infects CD4, T4 helper lymphocytes. So, the right answer is option A. T4 helper lymphocytes. Question 20. Cerebrovascular accident is not typically caused by option A. Hemorrhage. Option B. Atherosclerosis. Option C. Embolism. Option D. Brain abscess. The correct answer is option D. Brain abscess. Let's go through the options. Hemorrhage. Hemorrhage causes stroke. Atherosclerosis. Atherosclerosis causes ischemic stroke. Embolism. Embolism causes stroke. And the correct answer is brain abscess. Correct. A brain abscess is an infective mass, not a typical cause of a cerebrovascular accident. So, the right answer is option D. Brain abscess. Question 21. An epigastric hernia occurs through the option A. Linea alba. Option B. Inguinal canal. Option C. Femoral canal. Option D. Umbilical ring. The correct answer is option A. Linea alba. Let's go through the options. Inguinal canal. The inguinal canal transmits inguinal hernias. Femoral canal. The femoral canal transmits femoral hernias. Umbilical ring. The umbilical ring transmits umbilical hernias. And the correct answer is linea alba. Correct. An epigastric hernia protrudes through the linea alba above the umbilicus. So, the right answer is option A. Linea alba. Question 22. A 24-year-old female with painful defecation most likely has option A. Perineal abscess. Option B. Hemorrhoids. Option C. Fistula in ano. Option D. Anal fissure. The correct answer is option D. Anal fissure. Let's go through the options. Perineal abscess. A perineal abscess gives constant throbbing pain and swelling, not the tearing pain of defecation. Hemorrhoids. Hemorrhoids are usually painless unless thrombosed. Fistula in ano. A fistula gives discharge, not primarily painful defecation. And the correct answer is anal fissure. Correct. An anal fissure gives severe pain on defecation in a young adult. So, the right answer is option D. Anal fissure. Question 23. Sentinel piles indicate an underlying. Option A. Fistula. Option B. Carcinoma. Option C. Anal fissure. Option D. Prolapse. The correct answer is option C. Anal fissure. Let's go through the options. Fistula. A fistula is not marked by a sentinel pile. Carcinoma. Carcinoma is not the classic association. Prolapse. Prolapse is not the classic cause. And the correct answer is anal fissure. Correct. A sentinel pile, skin tag, marks a chronic anal fissure. So, the right answer is option C. Anal fissure. Question 24. In acute cholecystitis, which is not expected? Option A. Blood in stool. Option B. Fever. Option C. Right hypochondrial pain. Option D. Positive Murphy sign. The correct answer is option A. Blood in stool. Let's go through the options. Fever. Fever is expected. Right hypochondrial pain. Right hypochondrial pain is expected. Positive Murphy sign. A positive Murphy sign is expected. And the correct answer is blood in stool. Correct. Blood in the stool is not expected in acute cholecystitis. So, the right answer is option A. Blood in stool. Question 25. A white leg after delivery is due to option A. Arterial occlusion. Option B. Femoral vein thrombosis with lymphatic obstruction. Option C. Cellulitis. Option D. Compartment syndrome. The correct answer is option B. Femoral vein thrombosis with lymphatic obstruction. Let's go through the options. Arterial occlusion. Arterial occlusion causes a pale cold pulseless limb, not the swollen white leg of pregnancy. Cellulitis. Cellulitis gives a red, not white, leg. Compartment syndrome. Compartment syndrome is a different picture. And the correct answer is femoral vein thrombosis with lymphatic obstruction. Correct. Phlegmasia albadolens, white leg, is femoral vein thrombosis with lymphatic obstruction. So, the right answer is option B. Femoral vein thrombosis with lymphatic obstruction. Question 26. Berger disease may progress to option A. Aortic aneurysm. Option B. Gangrene of the digits. Option C. Renal failure. Option D. Stroke. The correct answer is option B. Gangrene of the digits. Let's go through the options. Aortic aneurysm. Berger disease affects small medium limb vessels, not the aorta. Renal failure. It does not typically cause renal failure. Stroke. It does not typically cause stroke. And the correct answer is gangrene of the digits. Correct. Thromboangiitis obliterans progresses to digital gangrene. So, the right answer is option B. Gangrene of the digits. Question 27. The first stage of carcinoma of the urinary bladder is treated by option A. Radical cystectomy. Option B. Transurethral resection with intravesical therapy. Option C. Radiotherapy alone. Option D. Chemotherapy alone. The correct answer is option B. Transurethral resection with intravesical therapy. Let's go through the options. Radical cystectomy. Radical cystectomy is overtreatment for superficial, stage 1 bladder cancer. Radiotherapy alone. Radiotherapy alone is not first line for superficial disease. Chemotherapy alone. Chemotherapy alone is not first line. And the correct answer is transurethral resection with intravesical therapy. Correct. Early, non-muscle invasive, bladder cancer is treated by TURBT with intravesical therapy, e.g. BCG. So, the right answer is option B. Transurethral resection with intravesical therapy. Question 28. Hydrocele is treated by option A. Antibiotics. Option B. Aspiration alone. Option C. Surgery. Option D. Observation only. The correct answer is option C. Surgery. Let's go through the options. Antibiotics. Antibiotics do not cure a hydrocele. Aspiration alone. Aspiration alone recurs. Observation only. Observation is only for small asymptomatic cases, not definitive. And the correct answer is surgery. Correct. A hydrocele is definitively treated surgically. So, the right answer is option C. Surgery. Question 29. Phimosis is not treated by option A. Circumcision. Option B. Cryosurgery. Option C. Preputioplasty. Option D. Topical steroid. The correct answer is option B. Cryosurgery. Let's go through the options. Circumcision. Circumcision treats phimosis. Preputioplasty. Preputioplasty treats phimosis. Topical steroid. Topical steroid can treat mild phimosis. And the correct answer is cryosurgery. Correct. Cryosurgery is not a treatment for phimosis. So, the right answer is option B. Cryosurgery. Question 30. Ulnar nerve injury produces option A. Foot drop. Option B. Ape-like hand. Option C. Wrist drop. Option D. Claw hand involving the little and ring fingers. The correct answer is option D. Claw hand involving the little and ring fingers. Let's go through the options. Foot drop. Foot drop is a common peroneal nerve lesion. Ape-like hand. Ape hand is a median nerve lesion. Wrist drop. Wrist drop is a radial nerve lesion. And the correct answer is claw hand involving the little and ring fingers. Correct. Ulnar nerve injury gives a claw hand affecting the ring and little fingers. So, the right answer is option D. Claw hand involving the little and ring fingers. Question 31. Median nerve injury produces option A. Wrist drop. Option B. Claw hand. Option C. Ape-like hand. Option D. Winged scapula. The correct answer is option C. Ape-like hand. Let's go through the options. Wrist drop. Wrist drop is a radial nerve lesion. Claw hand. A full claw hand is an ulnar lesion. Winged scapula. Winged scapula is a long thoracic nerve lesion. And the correct answer is ape-like hand. Correct. Median nerve injury gives an ape hand with thinner wasting and loss of thumb opposition. So, the right answer is option C. Ape-like hand. Question 32. The commonest cause of wrist drop is injury to the option A. Median nerve. Option B. Ulnar nerve. Option C. Radial nerve. Option D. Axillary nerve. The correct answer is option C. Radial nerve. Let's go through the options. Median nerve. The median nerve does not cause wrist drop. Ulnar nerve. The ulnar nerve does not cause wrist drop. Axillary nerve. The axillary nerve affects the deltoid, not wrist extension. And the correct answer is radial nerve. Correct, radial nerve injury is the commonest cause of wrist drop. So, the right answer is option C. Radial nerve. Question 33. Carcinoma of the cervix is caused by option A. Herpes simplex. Option B. Human papillomavirus types 16 and 18. Option C. Chlamydia. Option D. Cytomegalovirus. The correct answer is option B. Human papillomavirus types 16 and 18. Let's go through the options. Herpes simplex. Herpes simplex is not the established cervical carcinogen. Chlamydia. Chlamydia is a cofactor, not the cause. Cytomegalovirus. CMV is not the cause. And the correct answer is human papillomavirus types 16 and 18. Correct, HPV types 16 and 18 cause most cervical carcinoma. So, the right answer is option B. Human papillomavirus types 16 and 18. Question 34. Which is not a risk factor for endometrial carcinoma? Option A. Multiparity. Option B. Obesity. Option C. Unopposed estrogen. Option D. Late menopause. The correct answer is option A. Multiparity. Let's go through the options. Obesity. Obesity is a risk factor. Unopposed estrogen. Unopposed estrogen is a risk factor. Late menopause. Late menopause is a risk factor. And the correct answer is multiparity. Correct, multiparity is protective, so it is not a risk factor for endometrial cancer. So, the right answer is option A. Multiparity. Question 35. Which is not a risk factor for carcinoma of the breast? Option A. Nulliparity. Option B. Early menopause. Option C. Late menopause. Option D. Family history. The correct answer is option B. Early menopause. Let's go through the options. Nulliparity. Nulliparity is a breast cancer risk factor. Late menopause. Late menopause is a risk factor. Family history. Family history is a risk factor. And the correct answer is early menopause. Correct, early menopause is protective, so it is not a risk factor. So, the right answer is option B. Early menopause. Question 36. Carpal tunnel syndrome in a young woman is commonly precipitated by option A. Exercise. Option B. Anemia. Option C. Smoking. Option D. Pregnancy. The correct answer is option D. Pregnancy. Let's go through the options. Exercise. Exercise does not precipitate carpal tunnel syndrome. Anemia. Anemia is not the classic precipitant. Smoking. Smoking is not the classic precipitant. And the correct answer is pregnancy. Correct, pregnancy, fluid retention, commonly precipitates carpal tunnel syndrome. So, the right answer is option D. Pregnancy. Question 37. Cervical mucus on day 12 of the cycle appears. Option A. Absent. Option B, thick and opaque. Option C, thin, clear and stretchy. Option D, blood-stained. The correct answer is option C, thin, clear and stretchy. Let's go through the options. Absent. Absent mucus occurs in the luteal phase, not mid-cycle. Thick and opaque. Thick opaque mucus is the luteal phase pattern. Blood-stained. Blood-stained mucus is not the normal ovulatory pattern. And the correct answer is thin, clear and stretchy. Correct around ovulation, day 12 to 14, cervical mucus is thin, clear and stretchy, spinbarkite. So, the right answer is option C. Thin, clear and stretchy. Question 38. Asymptomatic bacteriuria in pregnancy should be: Option A, treated with antibiotics. Option B, observed only. Option C, treated after delivery. Option D, ignored. The correct answer is option A, treated with antibiotics. Let's go through the options. Observed only. Observation alone risks pyelonephritis. Treated after delivery. Delaying to after delivery is unsafe. Ignored. Ignoring it is unsafe. And the correct answer is treated with antibiotics. Correct asymptomatic bacteriuria in pregnancy should be treated with antibiotics to prevent pyelonephritis. So, the right answer is option A. Treated with antibiotics. Question 39. Signs of placental separation include all except: Option A, falling uterine tone. Option B, sudden gush of blood. Option C, lengthening of the cord. Option D, rising of the fundus. The correct answer is option A, falling uterine tone. Let's go through the options. Sudden gush of blood. A sudden gush of blood is a sign. Lengthening of the cord. Cord lengthening is a sign. Rising of the fundus. The fundus rises and becomes globular as the placenta separates. And the correct answer is falling uterine tone. Correct, the uterus contracts, firms up. So falling tone is not a sign of separation. So, the right answer is option A. Falling uterine tone. Question 40. The second stage of labor ends with: Option A, expulsion of the fetus. Option B, full dilatation. Option C, delivery of the placenta. Option D, rupture of membranes. The correct answer is option A, expulsion of the fetus. Let's go through the options. Full dilatation. Full dilatation marks the start of the second stage. Delivery of the placenta. Delivery of the placenta ends the third stage. Rupture of membranes. Rupture of membranes is not the end of the second stage. And the correct answer is expulsion of the fetus. Correct, the second stage ends with expulsion, delivery of the fetus. So, the right answer is option A. Expulsion of the fetus. Question 41. During normal labor, between contractions the uterus should: Option A, contract further. Option B, remain contracted. Option C, relax completely. Option D, show no change. The correct answer is option C, relax completely. Let's go through the options. Contract further. The uterus should not contract further between contractions. Remain contracted. It should not stay contracted between contractions. Show no change. No change is incorrect, it relaxes. And the correct answer is relax completely. Correct, between contractions the uterus relaxes completely, preserving fetal blood flow. So, the right answer is option C. Relax completely. Question 42. Which is not a feature of normal labor? Option A. Descent of the head. Option B. Regular contractions. Option C. Progressive dilatation. Option D. Moderate vaginal bleeding. The correct answer is option D. Moderate vaginal bleeding. Let's go through the options. Descent of the head. Descent of the head is a feature of normal labor. Regular contractions. Regular contractions are a feature. Progressive dilatation. Progressive dilatation is a feature. And the correct answer is moderate vaginal bleeding. Correct, moderate vaginal bleeding is not a feature of normal labor, only a show. So, the right answer is option D. Moderate vaginal bleeding. Question 43. Molar pregnancy with a thin-walled ovarian cyst of 5 by 6 cm indicates. Option A. Dermoid cyst. Option B. Endometrioma. Option C. Theca lutein cyst. Option D. Serous cystadenoma. The correct answer is option C. Theca lutein cyst. Let's go through the options. Dermoid cyst. A dermoid does not arise from a molar pregnancy. Endometrioma. An endometrioma is unrelated to a mole. Serous cystadenoma. A serous cystadenoma is not HCG driven. And the correct answer is Theca lutein cyst. Correct, high HCG in a molar pregnancy causes Theca lutein cysts. So, the right answer is option C. Theca lutein cyst. Question 44. A woman with cardiovascular disease should avoid which contraceptive? Option A. Barrier method. Option B. Copper IUD. Option C. Combined oral contraceptive pills. Option D. Progestogen only pill. The correct answer is option C. Combined oral contraceptive pills. Let's go through the options. Barrier method. A barrier method is safe in cardiac disease. Copper IUD. A copper IUD is generally safe. Progestogen only pill. The progestogen only pill is generally acceptable. And the correct answer is combined oral contraceptive pills. Correct, combined oral contraceptives raise thrombotic risk and are avoided in cardiovascular disease. So, the right answer is option C. Combined oral contraceptive pills. Question 45. Apneic spells in a preterm infant characteristically disappear by. Option A. 1 year. Option B. 4 months of life. Option C. 2 years. Option D. Birth. The correct answer is option B. 4 months of life. Let's go through the options. 1 year. 1 year is too late for apnea of prematurity. 2 years. 2 years is far too late. Birth. Birth is not when they resolve. And the correct answer is 4 months of life. Correct, apneic spells of prematurity typically resolve by a few months of life. So, the right answer is option B. 4 months of life. Question 46. Complete head holding is achieved at about. Option A. 9 months. Option B. 1 month. Option C, 6 months. Option D, 3 months. The correct answer is option D, 3 months. Let's go through the options. 9 months. 9 months is too late for head control. 1 month. 1 month is too early. 6 months. 6 months is later than full head control. And the correct answer is 3 months. Correct complete head control is achieved by about 3 months. So, the right answer is option D. 3 months. Question 47. A social smile appears at about. Option A, 6 months. Option B, 6 weeks. Option C, 9 months. Option D, 1 year. The correct answer is option B, 6 weeks. Let's go through the options. 6 months. 6 months is too late for a social smile. 9 months. 9 months is too late. 1 year. 1 year is too late. And the correct answer is 6 weeks. Correct, a social smile appears at about 6 weeks. So, the right answer is option B. 6 weeks. Question 48. Walking alone is achieved at about. Option A, 18 months. Option B, 6 months. Option C, 12 months. Option D, 24 months. The correct answer is option C, 12 months. Let's go through the options. 18 months. 18 months is later than average walking. 6 months. 6 months is far too early. 24 months. 24 months is too late. And the correct answer is 12 months. Correct, walking alone is achieved at about 12 months. So, the right answer is option C. 12 months. Question 49. Between 2 and 10 years, a child grows in height by about. Option A, 6 centimeters per year. Option B, 2 centimeters per year. Option C, 10 centimeters per year. Option D, 15 centimeters per year. The correct answer is option A, 6 centimeters per year. Let's go through the options. 2 centimeters per year. 2 centimeters per year is too slow. 10 centimeters per year. 10 centimeters per year is closer to infancy. 15 centimeters per year. 15 centimeters per year is a pubertal spurt, not steady childhood growth. And the correct answer is 6 centimeters per year. Correct, after infancy a child grows about 6 centimeters per year. So, the right answer is option A. 6 centimeters per year. Question 50. The intelligence quotient of a normal 7-year-old is. Option A, 90 to 110. Option B, 60 to 70. Option C, 120 to 140. Option D, below 50. The correct answer is option A, 90 to 110. Let's go through the options. 60 to 70. 60 to 70 is intellectual disability. 120 to 140. 120 to 140 is above average. Below 50. Below 50 is significant impairment. And the correct answer is 90 to 110. Correct, a normal IQ is about 90 to 110. So, the right answer is option A. 90 to 110. Question 51. Breastfeeding is contraindicated when the mother has Option A. Mastitis. Option B. HIV infection. Option C. Anemia. Option D. Diabetes. The correct answer is option B. HIV infection. Let's go through the options. Mastitis. Mastitis usually allows continued feeding. Anemia. Anemia is not a contraindication. Diabetes. Diabetes is not a contraindication. And the correct answer is HIV infection. Correct. Maternal HIV is a contraindication to breastfeeding where safe alternatives exist. So, the right answer is option B. HIV infection. Question 52. Prolonged neonatal jaundice beyond 2 weeks in a well baby suggests Option A. Sepsis. Option B. Biliary atresia only. Option C. Breast milk jaundice. Option D. Hemolysis. The correct answer is option C. Breast milk jaundice. Let's go through the options. Sepsis. Sepsis usually makes the baby unwell, not thriving. Biliary atresia only. Saying biliary atresia only is too restrictive and the baby is well. Hemolysis. Hemolysis usually presents earlier. And the correct answer is breast milk jaundice. Correct. Prolonged unconjugated jaundice in a thriving breastfed baby is breast milk jaundice. So, the right answer is option C. Breast milk jaundice. Question 53. Recurrent stones with urinary tract infection in a child suggest a defect at the Option A. Renal cortex. Option B. Bladder neck. Option C. Urethra. Option D. Pelviureteric junction. The correct answer is option D. Pelviureteric junction. Let's go through the options. Renal cortex. The renal cortex is not the classic obstructive site. Bladder neck. The bladder neck is a less classic pediatric site. Urethra. The urethra is a less classic site for stone with infection. And the correct answer is pelviureteric junction. Correct. A pelviureteric junction obstruction predisposes to stasis, stones and infection. So, the right answer is option D. Pelviureteric junction. Question 54. Grommet insertion is indicated in Option A. Otitis media with persistent effusion. Option B. Acute otitis media. Option C. Otosclerosis. Option D. Otitis externa. The correct answer is option A. Otitis media with persistent effusion. Let's go through the options. Acute otitis media. Acute otitis media is treated medically first. Otosclerosis. Otosclerosis is treated with stapedectomy. Otitis externa. Otitis externa is treated topically. And the correct answer is otitis media with persistent effusion. Correct. Grommets are inserted for persistent otitis media with effusion, glue ear. So, the right answer is option A. Otitis media with persistent effusion. Question 55. Adenoids are largest at what age? Option A. 12 years. Option B. Birth. Option C. 3 to 7 years. Option D. Adulthood. The correct answer is option C. 3 to 7 years. Let's go through the options. 12 years. 12 years is when adenoids are regressing. Birth. Adenoids are small at birth. Adulthood. They atrophy by adulthood. And the correct answer is 3 to 7 years. Correct adenoids are largest around 3 to 7 years. So, the right answer is option C. 3 to 7 years. Question 56. Adenoids are best visualized on option A. Waters view. Option B. Anteroposterior skull film. Option C. Chest X-ray. Option D. Lateral view X-ray of the postnasal space. The correct answer is option D. Lateral view X-ray of the postnasal space. Let's go through the options. Waters view. A Waters view shows sinuses, not adenoids. Anteroposterior skull film. An ARP skull film is not the standard view. Chest X-ray. A chest X-ray does not show adenoids. And the correct answer is lateral view X-ray of the postnasal space. Correct adenoids are seen on a lateral soft tissue X-ray of the postnasal space. So, the right answer is option D. Lateral view X-ray of the postnasal space. Question 57. Gynae syndrome follows petrositis and involves which nerve? Option A. 6th cranial nerve. Option B. 3rd cranial nerve. Option C. 7th cranial nerve. Option D. 5th cranial nerve. The correct answer is option A. 6th cranial nerve. Let's go through the options. 3rd cranial nerve. The 3rd nerve is not the affected nerve. 7th cranial nerve. The 7th nerve is not the classic one here. 5th cranial nerve. The 5th nerve pain occurs but the palsy is of the 6th. And the correct answer is 6th cranial nerve. Correct Gynae syndrome, petrous apicitis, causes 6th abducens, nerve palsy with ear discharge and pain. So, the right answer is option A. 6th cranial nerve. Question 58. Vocal cord movement is best assessed with A. Option A. Mirror only. Option B. Rigid bronchoscope. Option C. Flexible laryngoscope. Option D. CT scan. The correct answer is option C. Flexible laryngoscope. Let's go through the options. Mirror only. A mirror gives a static view, not dynamic movement well. Rigid bronchoscope. A rigid bronchoscope is not for cord movement assessment. CT scan. CT does not show movement. And the correct answer is flexible laryngoscope. Correct, a flexible laryngoscope best assesses vocal cord movement in the awake patient. So, the right answer is option C. Flexible laryngoscope. Question 59. Follicular tonsillitis characteristically produces option A. Hoarseness. Option B. Fever from pyrogens. Option C. Stridor. Option D. Trismus. The correct answer is option B. Fever from pyrogens. Let's go through the options. Hoarseness. Hoarseness is a laryngeal, not tonsillar, symptom. Stridor. Stridor is not typical of tonsillitis. Trismus. Trismus suggests a quinsy, not simple tonsillitis. And the correct answer is fever from pyrogens. Correct, follicular tonsillitis causes fever from bacterial pyrogens. So, the right answer is option B. Fever from pyrogens. Question 60. Aspergillosis of the ear is diagnosed by Option A. Biopsy only. Option B. Blood culture. Option C. Serology only. Option D. Skin hypersensitivity testing. The correct answer is option D. Skin hypersensitivity testing. Let's go through the options. Biopsy only. Biopsy alone is not the routine diagnostic step for otomycosis. Blood culture. Blood culture does not diagnose it. Serology only. Serology alone is not standard. And the correct answer is skin hypersensitivity testing. Correct. Per key, hypersensitivity allergy testing is chosen here. Note otomycosis is usually diagnosed on microscopy culture of debris. Flagged. So, the right answer is option D. Skin hypersensitivity testing. Question 61. Otitis media with effusion characteristically shows which tympanogram? Option A. Type A. Option B. Flat curve type B. Option C. Type as. Option D. Type C only. The correct answer is option B. Flat curve type B. Let's go through the options. Type A. Type A is normal, not effusion. Type as. Type as indicates a stiff otosclerotic drum. Type C only. Type C indicates negative middle ear pressure, not frank effusion. And the correct answer is flat curve type B. Correct otitis media with effusion gives a flat type B tympanogram. So, the right answer is option B. Flat curve type B. Question 62. Middle ear infection organisms most commonly include Option A. Pseudomonas. Option B. Streptococcus pneumoniae. Option C. Candida. Option D. Proteus. The correct answer is option B. Streptococcus pneumoniae. Let's go through the options. Pseudomonas. Pseudomonas is more typical of otitis externa. Candida. Candida is not the usual middle ear organism. Proteus. Proteus is not the usual middle ear organism. And the correct answer is Streptococcus pneumoniae. Correct. Streptococcus pneumoniae is a leading cause of acute otitis media. So, the right answer is option B. Streptococcus pneumoniae. Question 63. Silver nitrate 1% eye drops were historically used to prevent Option A. Ophthalmia neonatorum. Option B. Cataract. Option C. Glaucoma. Option D. Trachoma. The correct answer is option A. Ophthalmia neonatorum. Let's go through the options. Cataract. It was not used for cataract. Glaucoma. It was not used for glaucoma. Trachoma. It was not used for trachoma. And the correct answer is ophthalmia neonatorum. Correct. Silver nitrate drops, creed prophylaxis, prevented ophthalmia neonatorum. So, the right answer is option A. Ophthalmia neonatorum. Question 64. Acute angle closure is initially treated with A. Option A. Steroid. Option B. Mydriatic. Option C. Cycloplegic. Option D. Miotic such as pilocarpine. The correct answer is option D. Miotic such as pilocarpine. Let's go through the options. Steroid. Steroids do not open the angle. Mydriatic. A mydriatic dilates and worsens angle closure. Cycloplegic. A cycloplegic worsens angle closure. And the correct answer is meiotic such as pilocarpine. Correct. A meiotic such as pilocarpine constricts the pupil and opens the drainage angle. So, the right answer is option D. Meiotic such as pilocarpine. Question 65. After cataract surgery, posterior capsular opacification is treated with option A. Argon laser. Option B. Nd:YAG laser. Option C. Excimer laser. Option D. Cryotherapy. The correct answer is option B. Nd:YAG laser. Let's go through the options. Argon laser. Argon laser is used for retinal photocoagulation, not capsulotomy. Excimer laser. The excimer laser is for corneal refractive surgery. Cryotherapy. Cryotherapy is not used for capsular opacification. And the correct answer is Nd:YAG laser. Correct. Posterior capsular opacification is treated with Nd:YAG laser capsulotomy. So, the right answer is option B. Nd:YAG laser. Question 66. Amoxicillin 2 grams as surgical prophylaxis is given. Option A. 2 hours before the procedure. Option B. After the procedure. Option C. 1 week before. Option D. At induction only. The correct answer is option A. 2 hours before the procedure. Let's go through the options. After the procedure. Giving it afterwards misses prophylaxis. 1 week before. 1 week before is far too early. At induction only. At induction only is not the timing in this key. And the correct answer is 2 hours before the procedure. Correct. Surgical amoxicillin prophylaxis is given about 2 hours before the procedure. So, the right answer is option A. 2 hours before the procedure. Question 67. Which agent has the maximum duration of action among neuromuscular blockers listed? Option A. Mivacurium. Option B. Suxamethonium. Option C. Atracurium. Option D. Doxacurium. The correct answer is option D. Doxacurium. Let's go through the options. Mivacurium. Mivacurium is short-acting. Suxamethonium. Suxamethonium is ultra-short-acting. Atracurium. Atracurium is intermediate. And the correct answer is Doxacurium. Correct. Doxacurium is a long-acting non-depolarizing blocker. So, the right answer is option D. Doxacurium. Question 68. Melphalan is the drug of choice in option A. Aplastic anemia. Option B. Chronic myeloid leukemia. Option C. Lymphoma. Option D. Multiple myeloma. The correct answer is option D. Multiple myeloma. Let's go through the options. Aplastic anemia. Melphalan is not first line for aplastic anemia. Chronic myeloid leukemia. It is not the drug for CML. Lymphoma. It is not first line for lymphoma. And the correct answer is multiple myeloma. Correct. Melphalan is a classic drug for multiple myeloma. So, the right answer is option D. Multiple myeloma. Question 69. Bisphosphonates act by option A. Blocking parathyroid hormone. Option B. Increasing osteoclast activity. Option C. increasing calcium absorption. Option D, decreasing osteoclast activity. The correct answer is option D, decreasing osteoclast activity. Let's go through the options. Blocking parathyroid hormone. It does not block PTH. Increasing osteoclast activity. It decreases, not increases, osteoclast activity. Increasing calcium absorption. It does not primarily increase calcium absorption. And the correct answer is decreasing osteoclast activity. Correct. Bisphosphonates inhibit osteoclast activity and bone resorption. So, the right answer is option D. Decreasing osteoclast activity. Question 70. Dexamethasone is a recognized cause of. Option A, Paget disease. Option B, osteomalacia. Option C, osteopetrosis. Option D, osteoporosis. The correct answer is option D, osteoporosis. Let's go through the options. Paget disease. Steroids do not cause Paget disease. Osteomalacia. They cause osteoporosis rather than osteomalacia. Osteopetrosis. They do not cause osteopetrosis. And the correct answer is osteoporosis. Correct. Long-term corticosteroids cause osteoporosis. So, the right answer is option D. Osteoporosis. Question 71. In hypovolemic shock, the fluid of first choice is. Option A, dextrose 5%. Option B, ringer lactate. Option C, albumin. Option D, blood only. The correct answer is option B, ringer lactate. Let's go through the options. Dextrose 5%. 5% dextrose distributes poorly in the vascular space. Albumin. Albumin is not first line. Blood only. Blood only is not the initial choice before crystalloid. And the correct answer is ringer lactate. Correct. Ringer lactate, a balanced crystalloid, is the first choice resuscitation fluid in hypovolemic shock. So, the right answer is option B. Ringer lactate. Question 72. Absolute glaucoma refers to. Option A. A blind painful eye from end-stage glaucoma. Option B. Early glaucoma. Option C. Congenital glaucoma. Option D. Secondary glaucoma. The correct answer is option A. A blind painful eye from end-stage glaucoma. Let's go through the options. Early glaucoma. It is not early glaucoma. Congenital glaucoma. It is not congenital glaucoma. Secondary glaucoma. It is not simply secondary glaucoma. And the correct answer is a blind painful eye from end-stage glaucoma. Correct. Absolute glaucoma is an end-stage blind, painful eye. So, the right answer is option A. A blind painful eye from end-stage glaucoma. Question 73. The commonest cause of cataract is. Option A, diabetes. Option B, trauma. Option C, steroids. Option D, old age. The correct answer is option D, old age. Let's go through the options. Diabetes. Diabetes causes cataract but is not the commonest cause overall. Trauma. Trauma is a less common cause. Steroids. Steroids are a less common cause. And the correct answer is old age. Correct. Age-related, senile, cataract is the commonest cause. So, the right answer is option D. Old age. Question 74. Which statement about the lens is not true? Option A. It has no nerve supply. Option B. It is avascular. Option C. The second eye is always affected if lens protein is exposed. Option D. It continues to grow. The correct answer is option C. The second eye is always affected if lens protein is exposed. Let's go through the options. It has no nerve supply. The lens has no nerve supply, true. It is avascular. The lens is avascular, true. It continues to grow. The lens continues to grow throughout life, true. And the correct answer is the second eye is always affected if lens protein is exposed. Correct. The claim that the second eye is always affected by exposed lens protein is false. Phacoanaphylaxis is not inevitable. So, the right answer is option C. The second eye is always affected if lens protein is exposed. Question 75. Blurred vision with eye pain and an ESR of 85 mm suggests. Option A. Migraine. Option B. Optic neuritis. Option C. uveitis. Option D. Giant cell arteritis. The correct answer is option D. Giant cell arteritis. Let's go through the options. Migraine. Migraine does not raise the ESR. Optic neuritis. Optic neuritis does not classically raise the ESR to this degree. Uveitis. Uveitis does not typically give an ESR of 85. And the correct answer is giant cell arteritis. Correct. Eye pain with a very high ESR suggests giant cell temporal arteritis. So, the right answer is option D. Giant cell arteritis. Question 76. Cerebral contusion is characterized by pupils that are. Option A. Unequal always. Option B. Fixed and dilated. Option C. Pinpoint. Option D. Dilated and reactive to light. The correct answer is option D. Dilated and reactive to light. Let's go through the options. Unequal always. Unequal always overstates it. Fixed and dilated. Fixed dilated pupils suggest severe brainstem herniation, not simple contusion. Pinpoint. Pinpoint pupils suggest pontine or opioid causes. And the correct answer is dilated and reactive to light. Correct. In cerebral contusion, the pupils are typically dilated but still reactive to light. Item wording debatable, flagged. So, the right answer is option D. Dilated and reactive to light. Question 77. Extradural hematoma classically shows. Option A. Pinpoint pupils. Option B. A fixed dilated pupil with a slow pulse and rising blood pressure. Option C. Normal pupils. Option D. Bilateral ptosis. The correct answer is option B. A fixed dilated pupil with a slow pulse and rising blood pressure. Let's go through the options. Pinpoint pupils. Pinpoint pupils suggest pontine lesions, not extradural. Normal pupils. Normal pupils do not fit a deteriorating extradural. Bilateral ptosis. Bilateral ptosis is not the classic sign. And the correct answer is a fixed dilated pupil with a slow pulse and rising blood pressure. correct extradural hematoma gives an ipsilateral fixed dilated pupil with Cushing response, slow pulse, rising BP. So, the right answer is option B. A fixed dilated pupil with a slow pulse and rising blood pressure. Question 78. In myopia, the eyeball is option A longer than normal. Option B shorter than normal. Option C normal in length. Option D irregular only. The correct answer is option A longer than normal. Let's go through the options. Shorter than normal. A short eyeball causes hypermetropia. Normal in length. A normal length does not cause myopia. Irregular only. Irregular curvature causes astigmatism, not axial myopia. And the correct answer is longer than normal. Correct. In myopia, the eyeball is too long, focusing images in front of the retina. So, the right answer is option A. Longer than normal. Question 79. Good vision at night with poor vision by day suggests. Option A glaucoma. Option B peripheral cataract. Option C central cataract. Option D retinal detachment. The correct answer is option C central cataract. Let's go through the options. Glaucoma. Glaucoma does not give day blindness with good night vision. Peripheral cataract. A peripheral cataract does not selectively blur day vision. Retinal detachment. Retinal detachment gives field loss, not this pattern. And the correct answer is central cataract. Correct. A central cataract blurs vision in bright light, constricted pupil, but is better at night when the pupil dilates. So, the right answer is option C. Central cataract. Question 80. Ewing tumor of a long bone shows which X-ray appearance? Option A sunburst. Option B soap bubble. Option C onion peel. Option D ground glass. The correct answer is option C, onion peel. Let's go through the options. Sunburst. A sunburst appearance suggests osteosarcoma. Soap bubble. A soap bubble appearance suggests a giant cell tumor. Ground glass. A ground glass appearance suggests fibrous dysplasia. And the correct answer is onion peel. Correct. Ewing sarcoma shows an onion peel, late periosteel reaction. So, the right answer is option C. Onion peel. Question 81. A pathological fracture in an elderly patient most often results from. Option A metastatic deposits. Option B osteoporosis alone. Option C trauma. Option D infection. The correct answer is option A metastatic deposits. Let's go through the options. Osteoporosis alone. Osteoporosis alone causes fragility fractures, but metastasis is the pathological answer sought. Trauma. Trauma gives a normal, not pathological, fracture. Infection. Infection is a less common cause. And the correct answer is metastatic deposits. Correct. In the elderly, a pathological fracture most often results from metastatic deposits. So, the right answer is option A. Metastatic deposits. Question 82. Metastatic brain tumors most commonly arise from the. Option A lung. Option B kidney. Option C prostate. Option D thyroid. The correct answer is option A, lung. Let's go through the options. Kidney. The kidney is a less common source. Prostate. The prostate rarely metastasizes to brain. Thyroid. The thyroid is a less common source. And the correct answer is lung. Correct, the lung is the commonest source of brain metastases. So, the right answer is option A, lung. Question 83. Craniopharyngioma characteristically involves the option A, cerebellum. Option B, optic tract causing visual disturbance. Option C, brainstem. Option D, temporal lobe. The correct answer is option B, optic tract causing visual disturbance. Let's go through the options. Cerebellum. The cerebellum is not the site of a craniopharyngioma. Brainstem. The brainstem is not the site. Temporal lobe. The temporal lobe is not the site. And the correct answer is optic tract causing visual disturbance. Correct, a craniopharyngioma compresses the optic chiasm tract, causing visual field defects. So, the right answer is option B, optic tract causing visual disturbance. Question 84. Which tumor does not arise in the ovary? Option A, teratoma. Option B, dysgerminoma. Option C, pheochromocytoma. Option D, granulosa cell tumor. The correct answer is option C, pheochromocytoma. Let's go through the options. Teratoma. A teratoma arises in the ovary. Dysgerminoma. A dysgerminoma arises in the ovary. Granulosa cell tumor. A granulosa cell tumor arises in the ovary. And the correct answer is pheochromocytoma. Correct, a pheochromocytoma arises in the adrenal medulla, not the ovary. So, the right answer is option C, pheochromocytoma. Question 85. Testicular tumors are true of all except. Option A. They can produce a positive pregnancy test only in women. Option B. Seminoma is radiosensitive. Option C. They may secrete AFP. Option D. They spread to para-aortic nodes. The correct answer is option A. They can produce a positive pregnancy test only in women. Let's go through the options. Seminoma is radiosensitive. Seminoma is radiosensitive, true. They may secrete AFP. Some testicular tumors secrete AFP, true. They spread to para-aortic nodes. They spread to para-aortic nodes, true. And the correct answer is they can produce a positive pregnancy test only in women. Correct, the statement is false. Beta-HCG secreting testicular tumors give a positive pregnancy test in the male patient too. So, the right answer is option A. They can produce a positive pregnancy test only in women. Question 86. Health is defined by the WHO as. Option A, freedom from infection. Option B, absence of disease. Option C, physical fitness. Option D, complete physical, mental and social well-being and not merely absence of disease. The correct answer is option D, complete physical, mental and social well-being and not merely absence of disease. Let's go through the options. Freedom from infection. Freedom from infection alone is too narrow. Absence of disease. Absence of disease alone is the incomplete view who explicitly rejects. Physical fitness. Physical fitness alone is too narrow. And the correct answer is complete physical, mental and social well-being and not merely absence of disease. Correct. The WHO defines health as complete physical, mental and social well-being, not merely absence of disease. So, the right answer is option D. Complete physical, mental and social well-being and not merely absence of disease. Question 87. A basic health unit typically serves. Option A, 1 district. Option B, 4 union councils. Option C, 1 union council. Option D, 1 tehsil. The correct answer is option C, 1 union council. Let's go through the options. 1 district. A basic health unit does not serve a whole district. 4 union councils. It does not serve 4 union councils. 1 tehsil. It does not serve a whole tehsil. And the correct answer is 1 union council. Correct. A basic health unit typically serves 1 union council. So, the right answer is option C. 1 union council. Question 88. A rural health center typically serves. Option A, 4 union councils. Option B, 1 union council. Option C, 1 village. Option D, 1 district. The correct answer is option A, 4 union councils. Let's go through the options. 1 union council. 1 union council is the basic health unit's remit. 1 village. 1 village is too small. 1 district. 1 district is too large. And the correct answer is 4 union councils. Correct. A rural health center typically serves about 4 union councils. So, the right answer is option A. 4 union councils. Question 89. The commonest health problems in Balochistan include. Option A, trauma only. Option B, coronary disease only. Option C, cancer only. Option D, malaria, typhoid and respiratory disorders. The correct answer is option D, malaria, typhoid and respiratory disorders. Let's go through the options. Trauma only. Trauma alone understates the burden. Coronary disease only. Coronary disease alone is not the main rural burden. Cancer only. Cancer alone is not the main burden. And the correct answer is malaria, typhoid and respiratory disorders. Correct. Malaria, typhoid and respiratory disorders are among the commonest problems in Balochistan. So, the right answer is option D. Malaria, typhoid and respiratory disorders. Question 90. The oath taken by doctors includes all of the following principles except. Option A, profit maximization. Option B, beneficence. Option C, non-maleficence. Option D, justice. The correct answer is option A, profit maximization. Let's go through the options. Beneficence. Beneficence is a core principle. Non-maleficence. Non-maleficence is a core principle. Justice. Justice is a core principle. And the correct answer is profit maximization. Correct. Profit maximization is not part of the medical oath. So, the right answer is option A. Profit maximization. Question 91. Normal cardiac output is about. Option A 5 to 6 liters per minute. Option B 2 liters per minute. Option C 10 liters per minute. Option D 15 liters per minute. The correct answer is option A 5 to 6 liters per minute. Let's go through the options. 2 liters per minute. 2 liters per minute is too low. 10 liters per minute. 10 liters per minute is exercise level. 15 liters per minute. 15 liters per minute is far above resting output. And the correct answer is 5 to 6 liters per minute. Correct normal cardiac output is about 5 to 6 liters per minute. So, the right answer is option A. 5 to 6 liters per minute. Question 92. The normal resting pulse rate is option A 60 to 100 per minute. Option B 40 to 60. Option C 100 to 120. Option D 120 to 140. The correct answer is option A 60 to 100 per minute. Let's go through the options. 40 to 60. 40 to 60 is bradycardia. 100 to 120. 100 to 120 is tachycardia. 120 to 140. 120 to 140 is marked tachycardia. And the correct answer is 60 to 100 per minute. Correct, the normal resting pulse is 60 to 100 beats per minute. So, the right answer is option A. 60 to 100 per minute. Question 93. An athlete at rest characteristically has option A bradycardia, option B tachycardia, option C irregular rhythm, option D hypertension. The correct answer is option A bradycardia. Let's go through the options. Tachycardia. Tachycardia is not the resting athletic pattern. Irregular rhythm. An irregular rhythm is not characteristic. Hypertension. Hypertension is not the characteristic feature. And the correct answer is bradycardia. Correct, a trained athlete typically has resting bradycardia from high vagal tone. So, the right answer is option A. Bradycardia. Question 94. The sinoatrial node is located in the option A interventricular septum, option B left atrium, option C right ventricle, option D right atrium. The correct answer is option D right atrium. Let's go through the options. Interventricular septum. The interventricular septum houses the bundle, not the SA node. Left atrium. The left atrium is not the SA node site. Right ventricle. The right ventricle is not the SA node site. And the correct answer is right atrium. Correct, the sinoatrial node lies in the right atrium near the superior vena cava. So, the right answer is option D. Right atrium. Question 95. The accessory nerve supplies the sternocleidomastoid and option A pectoralis major, option B deltoid, option C trapezius, option D latissimus dorsi. The correct answer is option C trapezius. Let's go through the options. Pectoralis major. The accessory nerve does not supply pectoralis major. Deltoid. It does not supply the deltoid. Latissimus dorsi. It does not supply latissimus dorsi. And the correct answer is trapezius. Correct. The accessory, 11, nerve supplies sternocleidomastoid and trapezius. So, the right answer is option C. Trapezius. Question 96. The brachial plexus arises from roots. Option A, C5 to T1. Option B, C3 to C6. Option C, C7 to T3. Option D, C1 to C4. The correct answer is option A, C5 to T1. Let's go through the options. C3 to C6. C3, C6 is incorrect. C7 to T3. C7, T3 is incorrect. C1 to C4. C1, C4 forms the cervical plexus. And the correct answer is C5 to T1. Correct. The brachial plexus arises from roots C5 to T1. So, the right answer is option A. C5 to T1. Question 97. The radial artery is a branch of the option A, axillary artery. Option B, brachial artery. Option C, subclavian artery. Option D, ulnar artery. The correct answer is option B, brachial artery. Let's go through the options. Axillary artery. The radial artery is not a direct axillary branch. Subclavian artery. It is not a subclavian branch. Ulnar artery. It is not a branch of the ulnar artery. And the correct answer is brachial artery. Correct. The radial artery is a terminal branch of the brachial artery. So, the right answer is option B. Brachial artery. Question 98. The strongest bone in the body is the option A, tibia. Option B, femur. Option C, humerus. Option D, sternum. The correct answer is option B, femur. Let's go through the options. Tibia. The tibia is strong but not the strongest. Humerus. The humerus is not the strongest. Sternum. The sternum is not the strongest. And the correct answer is femur. Correct. The femur is the strongest and longest bone in the body. So, the right answer is option B. Femur. Question 99. The total number of bones in the adult human body is option A, 206. Option B, 186. Option C, 226. Option D, 246. The correct answer is option A, 206. Let's go through the options. 186. 186 is incorrect. 226. 226 is incorrect. 246. 246 is incorrect. And the correct answer is 206. Correct. The adult human skeleton has 206 bones. So, the right answer is option A. 206. Question 100. The number of genes in a human cell is approximately option A, 20,000 to 25,000. Option B, 2,000. Option C, 200,000. Option D, 2 million. The correct answer is option A, 20,000 to 25,000. Let's go through the options. 2,000. 2,000 is far too few. 200,000. 200,000 is too many. 2 million. 2 million is far too many. And the correct answer is 20,000 to 25,000. Correct. The human genome has roughly 20,000 to 25,000 protein coding genes. So, the right answer is option A. 20,000 to 25,000.